A painful announcement. Tatiana Schlossberg, the 35-year-old granddaughter of John F. Kennedy and daughter of Caroline Kennedy and Edwin Schlossberg, has revealed that she has been diagnosed with terminal acute myeloid leukemia. She wrote a deeply personal essay published on November 22nd, 2025, in a nod to the anniversary of her grandfather's assassination, to share the diagnosis and its emotional consequences. The diagnosis and treatment journey. According to her account, the diagnosis followed the birth of her second child in May 2024, when doctors noticed a very high white blood cell count shortly after delivery. Tests revealed a rare mutation known as inversion 3, which is typically found in older patients and makes prognosis particularly difficult. Her treatment has included chemotherapy, 2 stem cell transplants, one from her sister Rose and one from an unrelated donor, participation in clinical trials, and ongoing care. In one clinical trial, her doctor reportedly told her, "He could keep me alive for a year, maybe." Reflections and concerns. In her essay, Schlossberg reflects on many dimensions of her experience. She writes about how she could not believe that they were talking about me, given that just a day before she had swum a mile in the pool while 9 months pregnant, feeling healthy. She speaks poignantly of memory, parenthood, and the prospect of leaving her 2 very young children behind. She expresses frustration and concern with the broader healthcare/medical research system. Notably, she criticizes her cousin, Robert F. Kennedy Jr., now U.S. Secretary of Health and Human Services, for cutting significant funding for research, such as mRNA technology, research that she believes could have direct implications for cancer patients like herself. A legacy of loss. Schlossberg explicitly positions her news within the longer legacy of the Kennedy family's public and private tragedies. She writes that, "For my whole life I have tried to protect my mother and now laments that she has added a new tragedy to her life, to our family's life, and there's nothing I can do to stop it." She is aware of what she calls the Kennedy mythos of promise cut short, but she also turns inward, focusing not on history's weight but on the now that she still has with her loved ones. What this means. This is a rare, serious illness at an unexpectedly young age, underscoring the unpredictable nature of some cancers. The diagnosis and her subsequent public reckoning highlight not only the individual hardship, but also questions about medical research funding, technology, access to care, and how the health system supports patients with aggressive diseases. For the public, the announcement from a figure belonging to a storied American family reminds us that illness and mortality spare no one. For her family and children, it sets a deeply emotional context, one of cherishing time, memory, presence. Final thoughts. Tatiana Schlossberg's decision to publicly share this journey is both brave and wrenching. It offers a window into how one person grapples with impending loss, motherhood, legacy, and the system that supports, or sometimes fails, patience. At its core, it is a human story. A young woman, a wife, a mother, navigating the hardest of circumstances, and choosing to speak about it honestly,